Hello friends. Now we are going to talk on LASIK workup. That means it is actually refractive surgery workup. We need to find out whether a particular patient is eligible for any surgery or not, and he is better for which type of surgery. Now initially we started doing with topography, that means the mapping of the front part of the cornea. Then we had tomography, that means you are mapping the front and the back part of the cornea. As I told you, the hourglass over here is the cornea. But now what we have for last 3-4 years is MS39 machine, which is a combination of two technologies. One of them is tomography and one of them is SSOCT. So Scheimpflug imaging plus SSOCT. Now because of this we get a really accurate and reproducible, you can say, details of the cornea, which helps us in planning and also in understanding the eligibility. Then dry eye workup. Nowadays lot of population is working on computer screen. That causes lot of dryness, and therefore dry eye workup has to be done, because temporarily at least the dry eye may worsen in LASIK. It will be much more in LASIK as compared to smart sight, but it can worsen and we may not get some of the tests right if the dryness is there. Then this is another important new tool which has been added, Corvis ST. It will understand or measure the biomechanical strength of the cornea. Whenever we are doing refractive surgery, we are weakening the cornea. There are set guidelines how much the cornea can be weakened. There are rules, and if we follow these rules, usually we do not get problems. But this test will help us in making a choice between lenticular extraction, any type of LASIK, and surface ablation, as I explained in the previous video. Then there are tests to understand what is the accurate number. We may not be treating what prescription you are wearing, because that may not be the most accurate number. Retina examination is very important, because lot of patients with high and minus number, they have problems in the peripheral retina which they need to be addressed. And orthotics is muscle balance of the eye. Okay. Then there will be specialized tests for for like Contura, Wavelight Plus, etc. Now once we do all these tests, we get a proper understanding what type of surgery is best suited for that eye. So we are doing justice to the eye. At the same time, if the person wants to go for another surgery, it can certainly be done, but we will have to check the eligibility. Okay, like for example, in some technology the visual recovery will be slower than the other. In some technology dryness will be more than the other. In some technology the rehabilitation will be faster than the others. And all these points, depending upon like patient is coming from abroad, or what is patient's profession, and so many things it decide. Help us in choosing what type of surgery can be done. Thank you.